Hey, doulas. My name is Omni. I am the Director of Education here at INELDA, and I thought it could be helpful to do a little video about speaking our impact as end-of-life doulas. So, a little context. I have been a birth doula since 2016. And one of the things that kind of stood out to me as I moved into the end-of-life doula world as well was that in our birth space, we are very good at saying, right? It's part of how we tell people about what we do. We say that we improve, right? Positive birth outcomes. We decrease chances for maternal and infant mortality. And that is a huge, impactful statement to be able to say. As I stepped into the end of life doula world, I noticed that we are saying what we do, but we're not necessarily always saying the positive impact of what we do. And I think it can be really helpful to just have some language to use and to borrow until you really form your own way of communicating your positive impact. So, where is this information coming from? Um, I will go into a little PowerPoint presentation in a moment and just give you some basis for that. But I would also say this has emerged from conversations that I have had the chance to have with different hospice facilities, with doulas who are out there in their communities, for many different layers, right? For many different aspects of this, I have been hearing the same thing. Like, how do we tell people the importance of having an end of life doula? How do we get people to understand what we're doing? And so, from many of those conversations, I have sort of gathered together some great ways to speak your impact. So, let's dive right in. I'm going to share my screen. So, let's do it. First and foremost, if you are seeing this video on YouTube or someone shared it with you, I want to give you a little basis about who you're hearing this from. So again, my name is Omni Kitts Ferrara. I'm the Director of Education here. And INELDA, which stands for the International End of Life Doula Association, is one of the nation's largest and oldest end of life doula training organizations. We were formed in 2015, and we are a member-based nonprofit organization. We are absolutely dedicated to addressing needs and actions possible at end of life. And we learn from our incredible membership and from the many learners who have taken trainings with us over the years. We also have a wide network of providers, so hospice care providers, long-term care facilities, and different partnerships from the state all the way to the national level. One thing that I think is important to know is, we have learned a lot over the past 10 years. We have trained over 8,000 doulas in 46 different countries. So we are constantly trying to learn and be in a community of practice with the doulas that we serve. So how do we offer what we do, the information that we do? We offer it through end-of-life doula trainings for individuals. We have doula trainings that are also specific, that being our hospice doula training. And then also we support practicing doulas in the spectrum of end-of-life care. This is our team. I always like to show this slide because you are not just hearing from one person. You are hearing from an incredible collaboration of many voices with many diverse backgrounds. And so all of us come together and we really vet what we are teaching. We have really rich discussion over anything that we're presenting. And then we weave that together with the advice, the feedback, the learned wisdom of our members and our learners. So we are coming from a very vast network and background. So, one of the first things I can say to you as a doula is you have to be able to speak and know your role. People are going to ask, what do you do? You know, and if you are having conversations with nurses or chaplains or social workers, they may say, well, doesn't that feel like an overlap? Right? We hear this. Like maybe the doulas are trying to like take over certain aspects of my role. And what I can absolutely acknowledge is that in certain cases, there are absolutely moments or intersections of the methods that we provide, the role that we provide. However, it is still distinctly different from that of a nurse, a clinical provider, social worker, chaplain, etc. And so we can really support one another to provide the best possible person-centered care around. So know your definition, right? Our definition is an end-of-life doula is a non-medical person who accompanies, educates, and advocates. Let's just start with those three things. So sometimes if you're just meeting someone out there and they say, well, what do you do? You know, use those three words. I accompany dying people and their circle of care. I help to educate and contextualize the process of dying, and I advocate for their wishes, their autonomy. That's huge. You give them very concrete ways of just understanding what you do. And then the second part of this is going to give you some timeline of when and you know how it happens, right? So we do this work for people who are dying, who are planning for death, their circle of care. People can be diagnosed with a terminal illness or facing imminent death. Doulas also support people in communities who have experienced a sudden death. So we can do a lot of support work even after the fact, right? So you can talk about this with people. It isn't just at imminent dying, that I can be in communities, you know, giving talks about why we should have advanced care directives and what that can do for us. So we could do that all the way upstream. We could be alongside someone as they move through serious illness, palliative care. We can be with them as they are maybe utilizing hospice care at the end, and then even in the bereavement space afterwards. So these are ways we have to kind of get good at telling people what we do, what's our role. I think it's also important to say that we are not the ones in charge. So we do not come in there and give you a good death, right? Doulas support relational autonomy and person-driven care. We center around the person who is dying and who they choose as their inner circle. We listen to what that group, that intimate group decides is important. And then we enact resources and education and presence and support, right? But it's different than I'm a doula and I know everything about it and I'm going to tell you the best possible way to do it, right? We don't make those decisions. So I think it's important to say we support the autonomy of the person dying and their circle of care. We center around them. They are the driver. For those of you who work in hospice or in more clinical settings, I think it's important to be able to know that doulas can increase the workforce and we can help decrease some of healthcare staff's burnout because we are an extra hand. We can provide presence when, you know, a nurse's caseload is just too high to be able to sit with someone after a major change or a major development. Doulas are absolutely helpful in the workforce. And as I said earlier, if we are in our communities or in our hospitals or in our hospices or in our community centers, giving talks about why advanced care planning is important, we help people really make choices for themselves ahead of time so that in the event that death occurs more in a crisis or sort of in a surprise, those documents are there to decrease aggressive care, right? Sort of when time goes fast and we don't have the chance to talk about it, a lot of times we see that aggressive care is used to prevent death. If somebody has an advanced care directive, it gives the medical staff, it gives the family of that person directions. It tells all of us the preference of that person, right? So this is huge, and I think really important to be able to state to, especially, clinical world, be able to say that, be able to speak that. So still know your role. What are the methods that you provide? So if you are talking with a chaplain, right, you can talk about the differences and the intersections. And that goes for any role, any person that you're working with. So I won't read all of these, but just really be clear and be able to say, like, these are the methods I provide. This is how a doula can show up, right? So that you can have conversations with folks. Know your positive impact. This is huge. This is what I was talking about before. Getting good at saying, how we will improve outcomes, quality of life, even at end of life. So here is a lot of words. Take time, pause the video, read each one, try to understand each one and find a few that you really think would that feel real to you and that you can speak authentically when you're talking with people. But I will say that whether we are working in a community setting or we are working in a more hospitalized or healthcare delivery system, doulas increase encounters, they increase connection, they show up, right? And so when you have another person who's coming to sit, to listen, to understand the needs, to really notice changes in a person's, process, that is another set of eyes. That is another support system in the team, in the inner circle, and the care providers. And so it increases that, it increases person-driven care. We are there to notice and to notice, also the care providers and how's it all going. So we increase patient connection and encounters. For me, that's a huge one. I would also say another huge one for me is we support the self-determination of the person. We are listening to what they are asking for. And there in our definition, one of those three words I had you think about is we advocate. So if a person says this is really important to me, we can act like a parrot back. We can say this is really important to them. They've said this a few times, and I just want to make sure everybody is, hearing what they have asked for. And we don't have to be, we don't have to be sort of like defensive about it, but we can absolutely be another voice, just advocating the preferences and the self-determination of the person. Because we are also there and having these conversations, we can educate. If a family doesn't understand something, we can say, let's write down some questions so that when the doctor or the nurse or whoever we're talking about comes back, you have a list of questions to create clarity. And so we also support informed consent. We help with documentation of advanced care directives. All of this is big. And I think the last one that I'll point out is we decrease burnout, right? We have to take care of ourselves. That's another webinar or little video of itself. But we decrease burnout whether we are providing respite, right? We are being present with the person so that the primary caregiver can just like take a nap. We also, again, can be an additional person to activate in the interdisciplinary team in sort of a hospital setting or a hospice care setting. And so there's just more hands on deck and people can share the load in a more efficacious way. Okay, so huge aspects here. And as I said before I move all the way on from this slide, we decrease aggressive care. It is important to note that in the same way that there is there is a lack of equity in the delivery of healthcare, it is the same, right? And adverse outcomes negatively affect BIPOC communities more than their white counterparts. And so that same those same statistics and data are true at end of life. And so what we see is the inequity of care at end of life. There hasn't been enough resources, education around advanced care directive, around choice. What are my choices? And if doulas are out there in the communities, being able to really educate folks about what their choices are, and how to speak that, how to advocate for that, then in the moments of end of life, we have those documents in place. We understand the patient's and the person's preference, and then we are able to really sort of direct a medical team as well as help a family not to make such hard decisions because they know what their loved ones want. And because of the lack of resources, education, opportunity, a lot of times BIPOC communities face incredible aggressive care treatments at end of life, and there's just more trauma. So positive impact of doula is really vast, but hopefully you're starting to hear some of the ways in which you can speak this out. Now, this is a ton of research, and some people are going to want to hear research. They're going to want to read research. They're going to want to know that the actions that you do, the methods that you provide have some evidence around them. And so also as a doula, know where to point them and to get them to the research that they want. So along with this video, I have a PDF that I can share with you, and you can access that to be able to just help people get the research or get what they need to be able to understand the positive impact of doulas. No different avenues for funding. People ask us this. They say, well, how do you get paid, or how am I going to pay you? And so this is just kind of, this is the most common ways in which doulas are funded, end of life doulas are funded. We are not covered under Medicare as birth doulas are yet, but I think in the future we may be alongside them in that possibility. But for now, you can speak what you do, how you ask for funding, how you ask for compensation, or if you have ways to provide care for free. Every end of life doula does this differently. So know how you do it, be able to speak that. And if people are asking, you can say that the majority of end of life doula care is provided on a voluntary service to community. It is often just donated time. And there is a growing proportion of death doulas who work for payment. So they pay for service. And so just being able to see those two differences could be wonderful and helpful. If you are really interested in this, I would also continue to look into new and creative ways in which funding is happening. This can be through grants, it can be through foundations, it could be through you know, personal donations. I think there's a very interesting avenue that we can continue to lean into around public health funds. What are available in our states? What are available for us to say, yeah, this could be something that acts as public health or prevention or education. So get out there, be creative. And we know it often comes down to money, especially for, hospice organizations or more healthcare delivery systems. To get in and to really have some access, we might have to talk about how we as end of life doulas, another positive impact we can do is we can lower cost. That's something that some people want to hear. That's not going to be what we need to speak to everyone, but it is important to know this. So if we are included in the care, we again accompany, we educate and we advocate. Those are three huge things that we do, right? So if we are helping people understand their choices and options, direct them to the right avenues to finish their advanced care directives, and even if we're in communication with the family at the end of life and as things are occurring, we can help reduce hospitalizations, emergency treatments, aggressive care, all of which drive the cost up. We know that the primary cost drivers at end of life are increased hospitalization and length of stay, as well as using life-saving and aggressive treatments. But if we have been included in that conversation with them and we have had those wonderful, rich conversations, we decrease cost because we know what they want. And in many cases, we have a lot of studies that talk about this in palliative care. But when people are using palliative care, they often decline treatments, they decline life-saving aggressive treatments as well. But let me be clear, they decline curative treatments and aggressive treatments at end of life, which shows they actually live longer when they do that, and they have higher quality of life, and there is lower cost. So these are huge points, huge talking points for you to know. All right, last but not least, if you are working in a hospice and you are working as a volunteer, you may be a doula under that hospice, you may just be a volunteer. I think it's really important to speak with your volunteer coordinators, your administrators, and be able to point them in the right direction. So we have an additional video just for volunteer coordinators or administrators, and we conducted a think tank with hospices and partners that we have nationwide and asked them, all of them have doulas and are working to integrate doulas. And so we asked them, we said, what are the best practices? What have you learned? What works? What doesn't work? And so we have a guide. I will make another video. And that is specifically for the volunteer coordinators and administrators to speak your impact and to help them integrate doulas well. So know your resources, share your resources, be able to say, hey, I have this great video. It might be interesting. Here's some information. Here's a PDF. Here's some research. Be able to give them as much as possible because it will sort of push along the end of life doula field, and it will help us move into those spaces in which we can help provide delivery of autonomous, self-determined, and dignified care. So I hope that this has been helpful and given you some ideas of how to more potently speak the positive impact of end-of-life doulas. And I would love to hear from you and the feedback about these talking points, and if they're giving you a little bit more leverage or if people are just kind of listening further. I'm totally open and would love to hear that from you. So have a beautiful day. Get out there, speak your impact.